So what we found when we looked at these people that had been diagnosed with melanoma in Olmsted County over the past 3 decades was that the trend in the incidence of melanoma had risen pretty drastically over the past 3 decades. When you look at all people that have been diagnosed with melanoma over the past 3 decades, the chances of melanoma had risen 7.6-fold, which means people nowadays are 7.5 times higher likelihood of developing melanoma. But the striking thing is when you separated that according to gender or sex, men versus women, men were getting melanoma 4.5 times more likely, and women were getting melanoma 24 times more likely, which is just astounding. Even though it's almost like an epidemic that we're seeing as far as the incidence of melanoma goes, especially in women, the good thing was that people are surviving melanoma more often, which highlights the fact that if melanoma is found early, it's very treatable and curable. And in fact, every calendar year increase was associated with about a 7% higher chance of surviving melanoma, which means maybe as a society we're more likely to be aware of our skin, go get things checked out, especially women are more likely to do that, which even though we're seeing melanoma at astronomical rates, we're surviving it more. So there are many risk factors for skin cancer, and many skin cancer can be preventable. And although this study didn't look at risk factors particularly associated to this rise in incidence, we tend to think that habits and behaviors that were common back in the 1970s and 1980s perhaps are maybe catching up with society now. And if you look at some of the statistics with tanning beds, for example, they're very astounding that one session in a tanning bed increases your chances of melanoma by 20%. And nowadays, it's been found that women between the age of 18 and 29, 76% of their melanomas are associated with tanning bed use. And so things like that kind of make us think that the behaviors that were common back in the 80s are maybe catching up with middle-aged women nowadays. So with that in mind, there are some things that can help prevent skin cancer, help us catch it at an earlier phase, and those things include just being aware of your skin. Very good habit to get into to just look your skin over once a month, especially if you have some risk factors. If you fall into that category of somebody who's developed melanoma, your chances of a second melanoma is 9 times higher than average. And so a very good habit to get into to just look your skin over once a month. For sure, avoid tanning beds, use sunscreens in the morning after you get up, and see a dermatologist once a year.